Okay, Linda, what are we going to look at today?
We're going into the Nursing Arts Lab here on the West Campus to show you what kind of simulations we have to help student nurses know what to do and become familiar with, so when they go to a real hospital with real people, they'll feel comfortable.
Okay.
So let's go on into our Nursing Arts Lab. And here you can see we have 4 beds set up in this lab, and we can divide each bed so there's privacy as students want to practice. They can do like that.
Okay.
And each student then can be with their partner perhaps, or with the instructor, without any interference.
Okay.
The idea is that we want to set the room up very similar to the way they would find it in a regular hospital. So for instance, we have oxygen. We have suction devices that are on the wall. We have sharps containers where we can put needles that we've used so nobody gets hurt.
Oh, okay.
And we have the equipment in the bedside that we would be using: bedpans, water containers, everything that you would find in a regular hospital. Gloves. We're all set to treat the patient. And then, of course, we have the mannequin,
Okay.
the patient. And we can simulate, a lot of these mannequins can simulate having a heart attack, throwing
wow.
up, being in pain, having breathing problems. And we can control that with a computer so that we can have the patient doing anything and then have the student, how do you respond?
Okay.
Help them to respond correctly for the situation.
Okay.
So as you know, some of these patients can be, shall we say, heavy or overweight, and in which case we still treat them with the same way we would anybody, with respect and so on, but we need to be able to lift them. So
Okay.
we have our lifting equipment that we can train our students on,
So this is for heavier patients.
heavier patients,
Okay.
and that way we can lift them out of the bed to do a bedpan in a comfortable way. We want
Okay.
to treat everybody with as much respect as anybody else. Here you can see above the bed we have the orders NPO and
And
our
what
nurse-
does that stand for?
Well, it means nulli par os in Latin, but it means nothing by mouth in English. And the idea is we're not trying to starve the patient, but we don't want the patient to have anything by mouth if they are getting ready to go to surgery or have a procedure that we need them to have an empty stomach and an empty bowel so that it doesn't interfere with tests
Okay.
or with the operation. And you see the cabinets that we have built in. We have everything labeled, and we expect the students to become familiar with it just like they would in their own hospital, and where all the equipment is, and when they need to get a piece of equipment to be able to get right to it that they need for the patient.
Now, is this all standardized? Is it this way in every single hospital?
Well, it depends on whether you're an ICU or a general floor, but this is more like a general floor. This is not like ICU.
Okay.
So yes, this is what you would find on any general floor of a hospital. ICU and CCU tends to be more specialized, and so you might not have everything just laid out like this, but we want the students to know, to be familiar with what is generally available
Okay.
to other people. And here are 2 of our students now coming into practice.
Hello, students.
Yeah.
Practice Foley kits.
Yes,
Yeah.
Foley catheters.
Okay.
So that they can, for patients that are incontinent, we can help them to be able to empty their bladder without having to get out of bed,
Okay.
or without soiling their bed, which is helpful. And our students are timed. When they learn to put these pieces of equipment onto a patient, they have to do it correctly, and they are timed, and they have to do it sterilely. So that's why we have the privacy, so each student can practice without feeling intimidated until
Okay.
they're ready for their test. And they get tested in here too.
Okay.
Yeah.
All right. Well, thank you for the tour.
Yes, this is just one part of it. We'll go into other rooms.
Okay.
Okay, welcome to the Nursing Arts Lab on West Campus in the Health Science Building, HSB. So we're entering the Nursing Arts Lab, and as you can see, we have it set up much like a multiple hospital room. And each hospital bed contains a mannequin that we can cordon off so that we have some privacy as we're training students. So we try to provide everything here like you would see in a hospital. There's oxygen, there's a suction device to, in case somebody throws up, we need to suction, or if they're having a heart attack, we can suction before we intubate them. We have the sharps containers where any needles will go, exactly like you would find in a regular hospital room. In fact, we have bedside drawers full of equipment that you would perhaps need in each instance of having to treat a patient. And this is see, each room is exactly identically appointed. We also have the sophisticated hospital beds with the up and down, so you'll learn how to use those, because you have to be familiar with your bed in order to treat a patient should they have an emergency, have a code. We also practice putting patients on bedpans, so we have some of the equipment that you would find in a hospital, train you how to use that. That would lift heavy patients, so we can get them on their bedpan and get them situated. So you can see we have, on this bed we have NPO, which means nothing by mouth, so this person's going to surgery in the morning. We want to make sure their stomach is empty. And we have all of our cupboards, which are labeled with all of the equipment that you would find in a general hospital. So we really help the students know what it feels like to treat a patient and what equipment's available, and get them familiar so that when they get to a hospital with a real live patient, they have some sense of what they'll be doing. So thank you for this brief tour.